Doctors and nurses have been on the front lines battling the coronavirus for almost a year now, Brandon.
Yeah, and Kara Hay joins the conversation tonight. Kara, what's their reaction to all of this, the governor's executive order?
Well, I spoke to Valley medical professionals today who say yes, in their eyes, they believe we're on the right track, but pulling back restrictions too soon can reverse our state's progress.
The Health System Alliance of Arizona, representing over 80 medical facilities, sent out a statement saying now is not the time to relax mitigation efforts. Epidemiologist Kyle Freese agrees.
Well, in some ways, it almost feels like deja vu.
Dr. Freese says a similar easing of restrictions happened over the summer in July, and shortly after, the state experienced a sharp surge in cases.
It's just a really fine line that we're walking right now, because if we don't take this seriously for just a short while longer, there is always the potential that this aggressive virus will be able to take hold somewhere, and we can see another outbreak. And obviously, none of us want that to happen.
Of course, if you wait a few more months from now, more of us will be vaccinated, and then there's less chances of us ending up in the hospital and potential deaths.
But
you have to balance that with the fact that, there are losses of businesses, losing income,
which ER Dr. Frank Lavecchio says also has a negative impact on people's health. Both Freese and Lavecchio agree. With the number of people vaccinated, it's unlikely COVID illness will be as common or as severe as we've seen in the past. But the state is still not out of the clear.
The trends are pretty easy to follow. When we abide by public health restrictions and just buckle down as a community, we see things work. When we don't, we see surges.
Now, even if there is a spike in cases, Arizona's Department of Health Services says it's unlikely they will put restrictions back on businesses because of the number of people who are now vaccinated. Back to you.